Hmm. Now you also you talk about ECT, electroconvulsive therapy, and you're um, you're at pains, I think, to try and dispel what you consider myths around it. And let's face it, I mean, anyone who's seen the One Flew Over the Cuckoo's Nest, although a wonderful film, um, really did for ECT, didn't it? I mean, you couldn't come out of that film with anything other than a feeling of creeping horror. And anyone who might suggest you have it must be descended immediately from Nurse Ratched. And yet you point out that of all the treatments that we've had, it's the one that appears to have the fewest side effects and has helped a lot of people.
Yeah, I mean, that film, I think it was based on a time in the 1950s where, you know, I've talked to ECT practitioners and they think it's a great film. Like, I don't think it's not a myth that went on. It's just they don't see the other side of it, that was unmodified ECT, where there was no muscle relaxants, there was no sort of anesthesia, and it was brutal. You know, people, you know, broke bones and people were held down in their sort of hospital beds to receive it. And mainly, it was sometimes used for punishment and, you know, control. But when you see the nurses hold them down, that's to protect the patient, because the convulsions were so harsh that they often sort of, the muscles would contract so rapidly that they could break bones in their spine, in their femur. It was horrendous. And, you know, that film is an accurate depiction of that treatment. But when used for people with delusional depression, which is one of the, talking about the diversity, the rich sort of history of terms, when we talk about psychotic depression, it's, you know, very dangerous disease. It's you know, high rates of suicide, completely destroys someone, and, you know, will leave them institutionalized for long periods of time. And yet there's this treatment that does work within 3 or 4 sessions, and people chose, you know, the risk of fracture rather than having this debilitating mental illness. And so I do try and combine and, you know, hold these two thoughts in parallel in this history, that it has been abused and it has been, you know, used for a lot of horrendous things. And, you know, for people who aren't going to benefit, the side effects of memory loss are debilitating and their story should be remembered. But there's this really amazing story that, you know, ever since it was first invented in 1938, it has been, you know, one of the most effective, if not the most effective treatment for very severe depressions. And what I wanted to do was to see it myself and to talk to people who were currently in treatment with it. And, you know, this is, you know, I called her Alice in the book, and she's someone who's just got this amazing story of, you know, nothing else had worked. She'd been ill for decades. You know, this sort of pick and mix of pills have been thrown at her, and, you know, then finally someone tells her there's this doctor she needs to meet, and it's Dr. Kellner, Charles Kellner, who's one of the, you know, has been a leading figure in ECT research for 40 years. He just retired, and it, you know, makes her feel at peace from the first treatment. She wakes up thinking that she has a chance, and this is going to work for her. It's not a cure. It's something that will have to be, you know, used every few months when her symptoms maybe come back. There's some years she doesn't need it at all. So yeah, it's a powerful treatment. It's an aggressive treatment. I think, you know, we should remember both sides of the history rather than just stigmatizing it, because we forget the people who have this depression that isn't often seen, you know, on the streets and stuff. People who with very severe psychotic depressions, they do sometimes require aggressive treatments. Depression isn't a single sort of a single entity. Like my depression, people have, once reading my articles on ECT, have, you know, emailed me saying I should, you know, be tortured with ECT and see how, you know, how I'd like it then. And, you know, it's just, my response is, well, I probably wouldn't be prescribed it because my depression isn't, you know, suited to that type of treatment. But a little bit of a backhanded sort of approach to it. But you know, you get the point that it's a very effective treatment for one of the most debilitating types of depression.
Yes, I mean, I've had close, not personal, not firsthand, knowledge of it, but I've had personal dealings with this sort of thing, and you're right. And there's something, I think people sometimes confuse depression with being depressed. In other words, just feeling a bit low, and it's just, in some people, it's more like seeing someone trapped in a labyrinth in their own mind. Or, to be honest with you, I've come to understand why people in past centuries thought that people could be possessed, because they can be. Someone can be in the grip of what would seem to be a malign agency, which is not them, and yet it has them in its grip.
Well, I think a lot of, you mentioned that, I think a lot of witch hunts in history, and also more recently in sub-Saharan Africa, have been people that are depressed. I mean, one of the defining feature of quite severe depressions is this guilt that they've committed some wrongdoing, some sin, and if they believe it so wholeheartedly, and they're screaming about it, that they've done something, either they've murdered someone, or their bodies are rotten, and they're just not deserved of any sort of religious deity. And I think that if you have no idea of mental illness, and in, say, like the 16th century or whatever, it's you'd probably think that person has been possessed. I think a lot of these witch hunts were people who were suffering from depression.
Yes. There's some questions, if you don't mind, from
of course
people. Carrie Poppy says, what do you think of the popular books about trauma selling like hotcakes right now, like The Body Keeps the Score? So the connection between trauma and depression, what's your feeling about that?
Well, I wish my book would sell like hotcakes, is my first feeling, but that's not the case. No, I haven't read the book, and I'm not really sure I can comment other than trauma and depression go hand in hand. And I write not just about depression but mental illness more generally, and there's this idea that that there aren't these sort of clinical sort of discrete categories such as depression. I think trauma is something that can lead to PTSD or depression or schizophrenia, and I think it kind of makes us rethink about whether these are really discrete categories, or whether they're part of the same sort of pathological, or sort of the same vulnerabilities that are becoming expressed in different ways. So, for example, my cousin has schizophrenia, and I kind of wonder what set him down that path and me down more of a mood disorder. But one thing I'd say about trauma and depression is, that might be one of the best uses, or most hopeful uses of psychedelic therapy, being able to, especially with trials into MDMA. There's obviously a long way to go yet, and we're still trying to work out the best practices. But I think that's something that can allow people to reimagine what went on, and maybe not come to terms with it, but just see from a different perspective that isn't overwhelming and debilitating to them.
Yes. Well, I mean, your mind has paths in it. I mean, I always imagine it that way, and those paths can become so clearly marked, and everywhere else so overrun with brambles. It's difficult to get off a path, even if where it leads you is somewhere dark and not helpful to you. And sometimes you just need some way of getting off an over familiar path that's beginning to feel like a rat run. And if a psychoactive chemical or talking therapy can somehow clear away some of the brambles so you can get off that unhelpful path, that's surely a good thing.
Yeah, and it's what biological psychiatry has always lacked. They're treating symptoms, whereas I think psychotherapy, even in my case, can really get to the core of moments from your childhood that will be your depression almost feeds off. and it can, just with a few sentences, can really reframe your relationship with that person or that event.
Yes.
And that's, the best thing that could possibly happen. I mean, if that helps, then that has long-lasting effects.
Yes. Well, so an anonymous person raises this question, says, do previous life events trigger depression? In other words, and to some extent, yes, they do. They're going to be part of what can. Is trigger depression the right word though?
I think no. I wouldn't say that would be. I think trigger would be in the moment, but I think it's triggering that underlying predisposition. And did it say previous lives, as if we have more than one life, or is it?
No, previous life events. Sorry.
Okay, sorry,
that's me misreading it. Beg your pardon.
No, I was just wondering. That's a completely different discussion.
That's a very different discussion.
Yeah. So, yeah, I think that that combined with genetics is one of probably the two leading sort of vulnerability factors that then can be almost kept. And there's triggers that can then happen in either adolescence or adulthood that can really make those traumas and that experience become either depression or any other sort of mental illness. So yeah, I think that's probably one of the strongest links we have is from early childhood, either neglect or abuse or poverty. But there's also this sort of parallel story of resilience where it's not, that doesn't mean that you're defined by that. But there are, for the number of people who do develop severe mental illness, there are many who don't. And understanding those people is just as interesting as understanding the treatments. And a lot of that comes down to, well, partly biology, but also the social connections that people have. Who can they rely on outside of the group that is causing them harm? And really shows the power of community.
Yes. And someone else asks, can depression spread? Is it contagious? It's an interesting thing, because in the book you talk about how it may not be contagious the way that flu is contagious, but that the children or carers of people who have depression are much more, what's the right word, at risk?
Yeah.
Is that the right way of putting it?
Yeah. And some people do see depression as almost like an infectious disease. That's a emerging theory, that we should see it more as that it's not this thing that is bound by individuals, that it spreads through close proximity. It spreads from mother to child. It spreads from siblings. It can, people who live with people with depression, might suffer themselves. But generally, the strongest link is from parent to child, because they've got that genetic vulnerability that's partly shared. And then, so I use the example in my family history of my grandmother to my mother to me, all suffering from, and including my cousin, a range of mental illnesses. And it's something that does spread, but it doesn't spread through the air. It spreads down familial lines.
Yes, but also, if, as you say, one possible cause, at least for some people, depression is that lack of care, either maternal care or just the loss of some kind of object of love. That if you have a parent who feels that they're a terrible person, as we were talking about earlier, who feels that they're a positive danger to all around them and that they're unable to love, then they don't love because they feel they mustn't. And then that means that their children are suffering exactly that, this lack of care. So it spreads in that way as well, doesn't it? It doesn't need to be genetic necessarily.
No, exactly. It's spread by our social environment, of course. Yeah.
Yeah. And so those children just need someone to care.
Yeah, it can be, there are trials that have found, and behavioral studies that have found, it doesn't need to be parents. It can be, neighbors. It can be people you know, within the community that can support children and provide that sense of stability, whereas, you know, in the home they might not have that. And I think that's why it's so important for early identification to be within schools. And I don't want to say that teachers should become, you know, fluent in mental health practices. I think they've got enough on their plate right now, but there needs to be a way to, you know, identify those children at high risk and, you know, provide the support they need, because it's something that, you know, I lacked, and that's only, you know, just over 2 decades ago. And I think right now it will be amazing to find that support where children, you know, is where depression starts most of all. It's where it kind of almost takes root.
Yes, I mean, and it's you also cover in the book just how massive a problem it is. I mean, what was it? 2018, 16.6% of the UK population, nearly 1 in 5, certainly 1 in 6, had taken antidepressants in the previous 12 months. That is an epidemic.
Yeah, it's
just in terms of numbers of people.
Yeah,
I mean, call it an epidemic if it was a contagious disease.
True. Yeah.
Wouldn't we?
Antidepressants doesn't exactly match up to the prevalence. I think a lot of people are given us antidepressants for a whole range of problems, for anxiety, but yeah, even, you know, some, you know, studies find that it's around, you know, between 5 and 10%, usually around 10%. And so there's a large number of people who are suffering, and people say, you know, you live with depression, but it really depends on your circumstance. For me, it feels like suffering, and a lot of the time you're not living with it. So
living with, yes, you live with depression. That's like saying you live with chronic toothache. Of course you can, but who would wish that on anyone?
Yeah.
And it does make you think that it's a social problem. It's a problem which a society needs to think. That's 1 in 10. That's every person, one of their neighbours.
Yeah, I think
even if you live in a small cul-de-sac, it's probably 2 people in that cul-de-sac. 2, and their children need someone to love them. So it's not just a personal problem, isn't it? It's not one like, you know, someone needs to put a cast on their leg and then they'll get better.
No, it's something that affects the whole community. It affects people's employment. It affects, you know, how they function day to day. And yeah, what's worrying is how it does spread. And, you know, there are studies that find if you treat the depression, then it can really reduce that sort of spread through the family, which, you know, I hate to blame, you know, any of my mother or anyone that has suffered and, you know, unfortunately essentially like passed it on, if you want to use that term, because the onus shouldn't be on that person. It should be, you know, there should be treatments that are made available, and sort of so that if you kind of get rid of the depression, you reduce the risk for the people who are around them. And that's something that I think, you know, antidepressants are good for in a way, but I think psychotherapy at the moment isn't handed out as it should be. I think it's given in 2 smaller courses, and there isn't enough funding, so that people actually can maybe have like 16 sessions of whether it's CBT or interpersonal therapy or ACT, and, you know, really try and, you know, tackle depression when it first arises, rather than let it brew and, you know, become something that becomes essentially untreatable.
Yes, but I mean, the good news though is that it can be treated, and that someone who was depressed managed to write a book that thick and that good, and it is a good book. I mean, it's you know, so, you know, if someone says, well, so and so's depressed, it's not a death sentence. It's not like saying, you know, they'll never walk again. No, they will walk again.
Yeah, I mean, the book was, you know, a product of, you know, me, but also, you know, many hours of psychotherapy and thankfully antidepressants that work. And like we said, the book itself was in a way a form of treatment. And there were months when I was depressed writing that book, or not writing the book, in between. But yeah, thankfully they were few and far between because of treatment.
And the end product was you wrote a book, a really good book.
Thank you.
I'm afraid we've run out of time, although there were lots more questions to ask you. Thank you so much for talking to us, Alex.
Thank you.
It's been a real pleasure. And perhaps you can come back and answer more questions, because believe me, there's lots of them.
Gladly. Yeah, thanks for having me. It's been a great talk.
Bye-bye.